and you can go ahead and get going. Thank you.
Right. Um, I am presenting what I've presented in the past. I was going to redo it, but it doesn't change. Like our logic models are the same. So um, please use this opportunity even if you've seen the presentation in the past, ask questions, give feedback. We really want to hear it. Logic models are, once again, kind of falling behind in the agency. So we want to make sure that and I don't know that it's like a complete fall behind. I think we're really good at getting drafts done. It's just the completing them. And we do have COA coming up, so we will have to have those all set. And I'll get into the details on what we're looking for now. Right. We often refer to the logic model as a roadmap for a program service or even a coalition, depending on what you're building a logic model for. At LUK, we have we call the Gossamer thread and a PQI process. It's a partnership amongst programs, program development, and quality assurance. Really should be divisions and programs. We have what starts as the program development process, where we're developing a program model, usually during an application process, but not always. We might develop a model because we think it's great, and then Sandy and her team will look for grants that can help us fund our model. Once we do achieve funding for a program or service model, we go into implementation. Oh, sorry, let me go back. Program development process is led by program development, which is Sandy's team, in partnership with program leadership, quality assurance, and information and data. Program implementation is led by program leadership. That's important. So there's a handoff between program development and program leadership once we receive funding. But we're all still involved. So just the players get moved around in the process. Because then we move into program evaluation, where quality assurance leads the process. So everybody's at the table for this. And then program development redo is a process that's led by program leadership in general. Sometimes it's led by management team or program development because if something's gone not as intended, we'll say, or sometimes the model just isn't working as we intended and we need to go back and revisit the model. Sometimes maybe we're not getting referrals because of the model, for example. So let's say we have a service that provides puppies for kids, and DCF doesn't want puppies for kids. They want cats for kids. So then we have to revisit that model and, to Sandy's delight, now provide cats. So why do we do a logic model? That's another thing that we have to do while we're trying to implement a program. Well, according to the CDC, a logic model is a graphic depiction or roadmap that presents the shared relationships among the resources, activities, outputs, and outcomes or impacts for your program. It depicts the relationship between your program's activities and its intended effects in an implicit if-then relationship among the program elements. If I do this activity, then I expect this outcome. Among other things, the logic model helps clarify the boundary between what the program is doing and so what, the changes that are intended to result from the strong implementation of the what. That's a long way of saying everything within the logic model follows each other, from your goal and population conditions down to your activities, or your resources, the things that you need for the program enable you to do the activities, which enables you to have outputs, the things that we count for the activities, and ultimately our outcomes. Our outcomes all lead back to that goal for the program. A logic model can be used for program development and evaluation at the agency level to organize a coalition, and of course, always more. As anyone public health, Stephanie, we're very familiar with logic models in many different uses, other than the individual programs like we have at LUK. It's a process organizer. Logic models look different depending on how they're being used, who is providing the templates. We look at a federal logic model, it's going to look a lot different than our much simpler LUK logic model. The W.K. Kellogg Foundation is, they actually have a lot of great resources for program development if you're ever looking. Even though this is a 2004 guide, it's 20 years old, it's still very much relevant and very much used in program implementation and development and public health. They have a guide, Theory of Change in Logic Models, where they say a logic model is a systematic and visual way to present and share your understanding of the relationships among the resources you have to operate your program, the activities you plan, and the changes or results you hope to achieve. The W.K. Kellogg Foundation in 2004 also notes that logic models are not only important for an organization to be able to understand how to achieve its goals for the program, it also serves as a method to communicate the vision to funders and stakeholders. So it's not just for us, it's for others too. So it helps us be able to see the roadmap for our own programs. It can help train staff when they're coming into a program fresh, or being introduced to a new program. And it also is something that we can give to a stakeholder, and it gives all that important information in a one-pager, usually a one-pager, sometimes longer. So what is a logic model? Again, logic models might look different depending on who is creating it, but in general, it has resources or inputs into the program, the things that you need for the program to be able to provide the services, activities, what the program is doing or the service is doing in order to achieve the outcomes. The outputs are the tangible, countable things, the number of people you've served, the number of hours you've completed, the number of cats you've provided, anything that you count. And then outcomes are the percentage of youth that were able to develop a relationship with their new cat, for example, would be an outcome. And the goal and intended impact should directly relate to those outcomes. So our goal is to have 90% of DCF youth own a cat. And so by having 90% of our clients developing a relationship with the cat, we're reaching our goal.
Your focus there is the outcome is percentage of people involved in your program, not, I mean, it could be otherwise percentage of a population in general, right?
Correct.
It could be
Correct.
either or.
Yep, exactly. Thank you for bringing that up, Anthony. Often at LUK, we are talking about individuals, but then we do have services, which I'll show some examples of logic models where it's not about individuals, it's about communities or different cohorts that we intend to see some results. Training-based programs are often that. It's not about the individual, it's about the overall training results. So we start with planned work, and then we have the intended results. Outputs are plans. We don't just go into a program and hope for the best and accept that 2 cats are enough. We plan that in order to achieve true outcomes to affect our population, which we'll look at that in a minute, 2 cats isn't going to be enough. We're going to need, I would say, we're expecting 300 clients, so we want at least 290 to have cats by the end. All right, this is our logic model template. It's provided at implementation. I'll say that loosely because often we take an existing logic model and just save as and change as needed. But if you were ever to start from scratch, this just shows examples of what should be in each column. So we're going to dive deeper into this in the next few slides. So I'm not going to go into each of these examples because we'll see it in a minute, but I do want to show how it's a circular process. Again, all of this feeds into each other. There are logic models out there that actually, and I haven't seen one in a long time. I think they finally gave up on that, where it's like line by line. This resource does this activity, creates this output, and therefore this outcome. And I think we tried to do that once. It was silly. It didn't work. So you always want to start a logic model with who you're serving, of course. That's one of the most important pieces of a program or service, is that we know who our population conditions are. It's the people or groups and their characteristics that are intended to be impacted by the service. So it should include the person or group's demographics, such as age or gender, the location in which the program or service is going to be provided, the issue in which we're trying to address. Sometimes it's the number of intended recipients or members, but we don't see that a lot. That's usually the community change initiatives that we see those types of things, as you can see down here, 14,000 or more youth between the ages of 16 and 22. Yeah, it's important to be very clear about who you're serving, because if you say all of Central Massachusetts and you don't narrow it down, then that's a lot of service to be providing. So if we're talking about DCF youth without pets in Central Massachusetts, that narrows it down a lot more. Or even North Central Massachusetts, even smaller population. It's really important too, because if we're talking about LUK services, we want to serve, LUK has a specific area in which we serve. So we're not going to go into Franklin County. I know we do rarely have services in Franklin County, but we're not going to try to get 290 kids' cats in Franklin County, because that's not our normal catchment area. So we would want to make sure it's in Central Massachusetts. You should also have data to back this up. So we're not just picking a population because we like that population. We're doing it because there's a need there. And this is going to be important if you're doing the NPDI project, because I think we all have passions, but we have to make sure that it's not just our own passion, and it's actually a need that needs to be addressed in the community.
Yeah, that's like one of the questions I guess I have around this, and it attaches to what the comment I made earlier is, like, you can say this percentage of people that are going to be involved in this program, or this percentage of this demographic out in the world, out in Central Mass, say, will be impacted in this way. It's kind of like, I guess one of the things I wonder about is the balance of sometimes gathering that information, if it's a large area, or you're saying, okay, this many people in Central Mass are going to be impacted in their access to nutritious, healthy food. That's serious money on its own just to get that kind of information, to do that kind of a study. So I'm like, that's where I kind of wonder is, I assume it probably is better to just focus on the people that join the program, but ultimately we're trying to impact, say, a whole region of Central Mass or something like that. And collecting that kind of data, doing those kind of studies on their own is a huge amount of work and time and money. So I guess that's kind of one of the things I'm wondering about.
Yeah, no fear, because Sandy's not out there surveying the entire community. So we have a lot of resources that we can either point you to or provide for you if you are trying to identify a certain population or need. There is a lot of information out there, between census data. The government does a lot of different types of surveys. Hospitals do community needs assessments, and they're a great resource. LUK has a community needs assessment. It's okay. I'm not going to act like you're going to get a lot of information out of that one, but we're trying. United Way does a great survey. So it's being able to kind of pull the data out of where it exists. And we're not out there trying to survey the entire community, because that's
right.
a ton of work.
I guess that would be something to add to a logic model, or my response, particularly for NPDI, would be a timeline. So say you can access that data, you can access census and things like that, but knowing what the timeline is of the next cycle when that's going to be put out again, making sure to put that in here to say, okay, I won't have results for you guys until whatever 2027 or whenever the next time this comes out, because I'm going off of the data that's publicly accessible. We're not going to run our own huge collection here.
Yeah, you can. Oh, good. I was just about to call on her, Stephanie.
I was waiting to. I was like, I bet you she's going to, but I'm just going to go in and do it. Anthony, it's funny you say this, because I actually just spent a lot of time. We use the census for one of our things for our NPDI, and you're right, it does take a lot of time. I spent probably about a week and hours on end going through each whatever towns I was looking at, or the central area, and kind of doing that out. As far as like when the data is updated, that is like the most recent data. So most of the time you're only going to get up until the year before, because they're still working on that previous year. So that is like considered the most accurate data.
Right.
So I feel like as far as that, you really wouldn't have to worry too much, because you're going to get the most accurate data as of up to this point. And you can usually go by the trends from the previous years to kind of see, or use that as to kind of where you're heading. But like Shayna said, those websites, like the CDC has tools. I can put a couple too in the chat. The ones that we've been using for our other suicide prevention group grant, they gave us some really good tools, and you can like hit different demographics, what you're looking at, what you want to do. And it's really good information. And that stuff is really, I think that's really kind of what you're looking for, because I did the same thing. So
Cool.
I
Thank
hope
you.
that kind of
That'd be
helps.
awesome. Yeah. And Sandy's point is great too. Now with the government shutdown and everything, all the craziness going on there, that doesn't necessarily help, but yeah, that'd be great. Thanks.
It's a great question. Thank you.
Yeah, this is excellent. I just want to say too, fortunately, Massachusetts really values data collection and accurate data. So Department of Public Health and most of the other state departments do have good data for Massachusetts. And sometimes they'll drop it down to a smaller geographic level or population too. So.
You can get into some big rabbit holes if you go on the DPH website. So the goal of the program is the intended long-term impact result of the program or service. So this can get, in general, when we're trying to plan our programs, we think realistically. We're going to improve the lives of the children in DCF care by providing them cats. Again, the feds like to be really grandiose, and they're gonna take away all homelessness. So we don't necessarily want to say that on one of our own logic models, but we do have to say it sometimes when we have federal funding. Let's be realistic. We will never I don't want to say cure homelessness. I don't know what word I'm looking for, but it's just not going to happen. There will be homeless people probably forever, and because some people choose to be that way, so it's not going to go away. Be realistic about your goal of the program overall. All right, so Down at the bottom, we start going with resources. Resources are what feeds the program. What do you need to facilitate the program service to achieve that goal? It's going to include staff. You should have whoever's receiving the services, the consumers of the services. Any partners, funders are important. Without the funder, you wouldn't have a program. Evidence-based models and curriculums that you might use in the program. You might put supplies, materials, and software. It's often like our electronic health record. If food is part of your budget for the program, you would put food for meetings or whatever. In the past, we actually even provided childcare. So that would be both a resource and maybe an activity, depending on how the childcare was provided. Oh, sorry. Space, your office location or the service provision location, and then other things. Oh, I didn't even notice. Transportation is another one. If you're paid to provide the transportation, you put it on here. It doesn't really include, general transportation. It's transportation of clients. We move on to activities. Oh, geez. Sorry. I'm going to try to be mindful of time. It's already 12:40. Activities. What is the work being done in the program or service? What will be done with the resources? This list could get giant if I listed off every type of activity that might occur, but it might be outreach, community engagement, intake, assessment, discharge planning, might provide case management services or therapeutic services or support services. We do on-call 24/7, 365. We do provide transportation to clients to get to the service, or this is a training service. We do trainings, might do internal, external personnel trainings. It could be a program development service. We've had those before too, where we get paid to develop new programs, and there might be even an aftercare component. Any other activities people can think of that may be kind of off the wall that others might not think of? I think of something weird. Is that child? Oh, go ahead.
Oh, I was going to say, would marketing be a material or an activity?
Depends. Social marketing is absolutely an activity. Or social, it's a CES, the prevention. Yeah, where you're trying to change norms. That absolutely is an activity.
And it might be an output activity that creates an output. In general, marketing is not an activity that happens. It's not. We're not. Funders aren't paying for us to market our programs.
Yeah. One thing that I would add here too, that's occasionally an activity, is evaluation. Really depends on what the funder is looking for. If we have like an external evaluator or some like heavy duty evaluation expectations, we might put it in activities to make sure we are paying attention to that and giving it its attention that it needs.
Thank you, Andy. Outputs. I think this is sometimes the most confusing column in the logic model for people. We often are only looking for one output. This isn't complicated, although we sometimes have to make it complicated depending on the type of service or the funder. And these are the measurable components to the service, the program or service delivery. So if outreach is a major part of the service, that might be our output. So 70,000 individuals, it shouldn't be could be contacted. That'd be a lot of people to contact through outreach. No, what's the better word? 70,000 would usually be those social media posts. Our old YouTube channel, we'd see the number of views. What is another example? Oh, we used to have billboards, and then the billboard company would give us the numbers of assumed people that drove by that billboard, and we could say 70,000 people saw that billboard. Intakes, this one happens quite often. This is when we have a case management rate, so we're paid for every time somebody comes into the program. It's usually like one lump sum. Not always, but so we're given $250,000, and we're expected to do, based on that, 20 intakes per year. And that would be our output. Support services, 3 referrals per youth. So we have somebody in service, and there's an extra expectation. So this one is probably one of those secondary outputs, as you can see up here. Our secondary output would be like, of those 20 youth, we've put out 3 referrals for resources for the youth. If it's a training type program or it has a training component to it, we'd say number of trainings we've done, and maybe the type of people that we've trained. Because it might be very specific. We might need to say we've trained 60 clinicians, 10 first responders, 5 school administrators, and then program development. That's a fun one. Expand the service area to 5 surrounding towns in north central Massachusetts. What program was that we did that for? That was, I remember, I can't. I would like to provide you guys with an example, but it's been a long 17 years. And then aftercare, 60 aftercare contacts made per year. And that's not often that we see that. We have seen that a little bit increasing. So the expectation is that after a client leaves the service, there's some continuation. They're paying us to continue to do that. Generally don't try to do things or put them on the logic model unless we've been given the money to do so. Or it's an expectation. It's not just about money, but yeah. All right. And then my favorite column, outcomes. What are the intended benefits of the program? The outcomes should be measurable changes expected from the program activities. At LUK, we ask that every program identify at least 2 core program outcomes. And that's at least. We also don't want too many outcomes, but there's 2 core program outcomes. And when we're reporting generally in like a program evaluation, we might look at all the outcomes, but we're really going to focus on the top 2. Some examples, 85% of clients will increase functioning as measured by overall progress towards individualized goals as measured by the LUK Individual Action Plan. We take all of the goals for a program and at discharge, and then we take an average and of who made progress and report that for that outcome. When we're talking about, I think to Anthony's point, talking about how do we measure change in a community, it's super difficult. So you might be leaning on community needs assessments from outside, but for many of our CES programs, we have a youth and community survey that we utilize, which has lots of different information. And Sandy, is our YCS available like we can provide the regional data?
Right, the regional data.
Mm-hmm. Yeah. It is limited data. It's not going to talk about nutrition, Anthony, if that's what you were looking for. But if you're looking for, north central data for drinking or marijuana or violence, that's could be a helpful tool. So these are also usually community change is over time. So often 5 years. We don't expect change over a single year. Change, and it's a very small percentage too. So we have to be realistic. You see 85%. We've actually changed this. Actually, it's more reflected over here. Every year when we look at our outcomes, we say, are we being realistic? You said, you said 85%, and this is just coming back to me from a recent program evaluation. You said 50%, but you're actually hitting like 90% consistently. So let's talk about, let's increase our own expectations. Or is it really realistic that 85% of clients coming through substance use services are going to make progress on their substance use goals? Probably not, if I'm going to be honest. We have a very high rate of no-shows and people just kind of dropping off. So of course our outcomes aren't going to look that good. So we have to be realistic. So make sure, don't get stuck on a number, but don't set the bar so low that you achieve it easily too. You're not going to get funding if you set the bar too low. All right, this you did not see on the logic model. This is something that just kind of for your information, probably not helpful for NPDI unless we're really, it's too short of a time period for you to really get too deep into it. Some funders require additional reporting, and the logic model can be a place to document the additional data requirements to detail the additional work that program managers have to do. This is actually from our DMH logic model, and Sarah has to do all of this data reporting monthly. And it's something that we wanted to make sure that it's documented in a place that's, it's actually a significant part of the service because it takes Sarah a lot of time, and we're held to the, I don't know if there's really standards or what the standards are, but this is the kind of information that DMH is looking for, and might determine our continuation of funding if we're not, for one, providing that data on a monthly basis, but also, if they're seeing a high number of hospitalizations or youth aren't meeting their goals, that might cause a program redo or even loss of funding. We're working hard program development, trying to get reporting, rate completed every year on time. What time is it? Sorry, 12:50. Shira's done a lot of work on that, so we're really going to miss her again. But she set us up for some big success. I will put this this training in the program development seminar channel because there are some great tools here to create a logic model. To help you think about a logic model, you do need to use the LUK template for LUK logic models, but it's very similar to most any other template that you'll find within these resources. And I'm going to just bring up, oh gosh, sorry. My screen is, doesn't fit my whole computer screen, so I can't like exit out of documents and scroll. It's really annoying. All right, let's start off with just a random CES logic model for one of the community logic models that I want that would be helpful to show because it's a big catchment, or not catchment area. We're supposed to have contact with a lot of people. So Central Massachusetts, which is 27 North Central communities, are lacking resources for individuals experiencing mental illness. So in this one, we're looking to train a whole slew of people to recognize the signs and symptoms of mental illness and how appropriately and safely respond to and access resources. This must be one of Stephanie's programs then. The goal of the program is to increase the number of people who can recognize the signs and symptoms of mental illness and know how to appropriately and safely respond and access resources, and increase the number of people who have access to support groups related to suicide prevention. There's a whole lot for this program. This one, you can see the staff. This one requires a lot of partners. We have multiple funding sources for this program, and there's a lot of curricula. Since it's a training program, we can't just go and like, in general, we're just not going to make up stuff and go out and start presenting to the community. Funders want us to be utilizing a specific curriculum or training. And then this is the, oh my gosh, the fifth.
Strategic prevention framework.
All right. And then we have our activities, prevention, intervention, postvention, task force coordination, marketing, and then harm prevention, environmental strategies. There's a lot. So this one has a lot. So this is one of those, and one of the reasons I pulled it up because I saw it had a bunch of outputs. So we're responsible for the prevention by doing trainings, 600 trainees, 300 tailored trainees, 900 duplicated trainees. And then it's broken down even to the types of number of trainings we have to do for each curriculum. And then for intervention, we have even more that are specific to different populations. And then our postvention. So it's a lot being measured within this, a lot of activity sheets being completed. And then for this one, they got to pick 2 outcomes that were relevant to the different areas. So this one they're using for the prevention intervention. They're using a post-survey evaluation tool at their trainings to show an increased knowledge. And then for the postvention, support groups report satisfaction. And that's a tool that is being developed. All right. So that one's going to be very different from RISE. This is, I purposely chose 2 CES logic models because they deal with the community, but also with clients. So RISE stands for Resiliency and Independence for Student Empowerment. It's a middle school program specific to Memorial Middle School, so students grades 6 through 8 at Memorial who have identified risks. I'm not going to read everything. We identify high-risk youth and their families to participate in the services, to improve functioning in daily activities at school, home, and community through prevention intervention activities. And then we have our staff partners, because we're at the school, the service and the staff are at the school. We work with law enforcement and referrals to community agencies. So part of these school intervention services is that we are linking them to other supports within the community. And then, of course, other resources and materials. So refreshments, how to get kids to listen to you is to feed them. Sometimes we pay for a truck to come in and do some work, some group work, and there's sometimes staff required trainings for staff. So that's this list here. And of course, CareLogic, Proprio is our translation services, virtual gateway, and they have to enter information to REDCap. Again, the activities are going to look different. We have to develop partnerships as part of the program, but we also do case management, groups, provide some education services, and we have to do program evaluation. And then our program output, 30 to 40. We probably need to, that needs to be a number. This, sorry, it's a side, but usually you're going to pick one number. You're not going to give a range because that goes right into the contract database too. But yeah, no gray areas. And then for our core outcomes, we're utilizing IEPs. So that's individual action plans and CareLogic. And then there's also additional, because of DPH services, they want a lot of other information. So they have a youth assessments, and that's used as self-reports, and we're looking for improvement in different areas there. We often see that in where especially if you're not using individual action plan, but you're working with people, we do surveys all the time. So whether it's a pre and post, so like knowledge based, you know this, and then asking in after the service, it's after the service, a satisfaction survey maybe. Sometimes we use standardized assessments or tools because we're not experts. So it's great if we can find a tool like the caregiver. Oh gosh, why can't I think of it?
A caregiver strain.
Caregiver strain. Yes,
yeah.
yes. So we're providing services to the youth to decrease the strain for the caregiver. So we're not actually giving the survey to the kids. We're actually giving it to their parents, because the intent of a respite service is to reduce the strain on the caregiver. So outcomes are definitely one of my favorite things, and I definitely harp on them all the time. What's important about outcomes is that you have you have the target, but really you have a tool, and you have something that you want to measure, and you need a tool to measure it. So we often say, we used to, not anymore. We're doing so well with this. It used to just be 85% of youth will like their cat. But like, how do you know that? Like, we don't say how. So it might be an individual action plan, like showed progress towards like loving their cat, or you might give them a survey on how well they like their cat and taking care of their cat. So sorry, I really rushed that last part, but I ran out of time.
Yeah. No, thank you so much, Shanna. I really appreciate it. The PowerPoint will be available. We will make the recording available to folks too. And I totally love your example with the cats. That's perfect.
Had to. Sandy has 6 cats.
I do.
It's
Yes.
so great. I can't talk. I have 3 dogs and a cat. So
yeah. Well, thank you, everybody. If you have any questions, feel free to reach out. Sure, either directly to Shayna or through program development. We can help you connect to Shayna too. Awesome. Thank you, everybody.
thank you.